Obrigado, Dr. Mia. Good afternoon, Botardi. I am deeply honored and privileged to first have Professor Sutton, and then you can very well note that he is a very work-focused person, that he is already setting up his presentation and the setting up the stage for the discussion. But allow me to also recognize Professor Dr. Nilton, the former Minister of Health, Government of Timor-Leste, Sarah Costa, as was used as a National Director for Disease Control Program of Ministry of Health, and Jose, the Director, Executive Director of HAMNASA, our colleague Dominguez from INSVTL, Kun Pim from the Thailand Embassy, my colleague from UNDP, my WHO team, and more importantly, our young people, the students from university, the representatives from university. One more time, good afternoon, Botardi. We gathered at a very interesting junction. On one side of the room, in a manner of speaking, stands one of the founding minds of modern artificial intelligence. And on the other side sits a very young nation, and with a young health system, which is still evolving, which is still building the infrastructure, which is still making its workforce and the institutional memory that actually older systems from the countries that we come from takes it for granted. Today we are actually asking for these two words to speak to each other directly. And it's not a ceremonial gesture. In fact, that is what we keep thanking Professor Dr. Jose Ramasota, the Honorable President of the Republic of Timor-Leste, because he brought these scientists, these minds, to enable these young people to interact and to say that this is a consequential conversation for Timor-Leste. And while I introduced Professor Sutton, I was asking a question within myself, why Professor Sutton and why now? Because to me and to us, Professor Sutton is not simply an AI thinker and researcher. To us, you are one of the people who define what learning means to a machine. He built the conceptual and mathematical foundations of reinforcement learning, the branch of AI concerned not with memorizing patterns in static data, but with learning through interaction, through trial, error, and consequence. And Professor Sutton, to me, in my past life as a clinician and now as a public health person, this is the way a clinician, a district health officer, or a surveillance system learns. And that's something we thought is very pertinent to us all, because this is this body of work with your colleague that earned Professor Sutton the 2024 ACM A.M. Turing Award, the computing's highest honor. And it now underpins much of what we call agentic AI systems that act, observes, outcomes, and improve. I think I should not be spending more than what I have already between you and Professor Sutton, rather than bringing up the bitter lesson and other provocative theses that Professor Sutton brings in. But because we are talking about the surveillance, we will come to the local innovation as well after we have heard Professor Sutton. So allow me to one more time, on behalf of the people of Timor-Leste and the WHO team and the presidency standing and in the China Hall, welcome Professor Sutton and invite him for taking us through his presentation. And please mind that after the presentation, we will have a quick panel. And after the panel discussion, there will be time for us for the interaction, and you would be welcome to ask questions to Professor Sutton, but also to the other panelists as well. With that note, Professor Sutton, floor is yours. You are invited to take us through the journey. Over to you, Professor Sutton. A round of applause for
Cool, thank you very much. I'm still fiddling a little bit with my display. But I think we're okay. I want to make sure so everyone can see it well. So, it's my pleasure to talk to you today. And I've taken this chance to maybe set a little bit aside the focus of the panel and share with you my thoughts about how AI should work, how AI should be thought of generally. It is absolutely about learning from experience. And let me present that to you. And now everyone thinks that AI is making rapid progress, and there has been a breakthrough in skillful use of language and using computation to generate realistic images and video. And there are real applications which have led to new industries and real economic value. These applications are applications of super large-scale computation, pattern recognition. But what about the science of AI? What about our understanding of the mind? And in my mind, there is not rapid progress in related science. Yeah, it's not big rapid progress. And the models are not powerful. I think they're very knowledgeable, but otherwise they are weak. They are weak, they don't think very well, they meander, sometimes it's false what they say, and cool. So not at all powerful. That's what I see. But what is happening now? One very important thing that's happening now is, and has been happening really for like 100 years, is that computational power per dollar has been increasing exponentially. It's like doubling every 18 months of late. This is going to keep going. And it's really the fundamental thing that characterizes our time. If you look at this graph, along the bottom we have years, and along the y-axis, we have computer power per dollar on an exponential scale. So each one of those major tick marks, yeah, I can point, the major tick marks are 5 orders of magnitude. So that's 100,000 times between each one of these major tick marks. And the line here is actually curving slightly up. But if it was a straight line, it would be an exponential increase. So all this time, throughout the world wars, which you can hardly see in these lines, the computation has increased. Well, it's doubling every 18 months. We might say a factor of 10 every 5 years. And so every 5 years, it becomes 10 times more valuable if you can find the algorithms of intelligence. And so I think this just creates a powerful, persistent pressure for understanding intelligence. This is happening now. It's happening. It will be happening in the foreseeable future. This is what drives all the excitement. But if this is what is driving it, it's not just about intelligence. It's about computers. Computers are getting faster. Computers are getting more powerful. And that shows up all kinds of places. And when someone talks about, let's say, when we talk about AI, are we really talking about intelligence? Or are we just talking about faster computers? Computers being able to do more things. I think it's almost all just computers that are going faster. So if I want to say that it's non-intelligence, I should be clear about what intelligence is. So let's have some definitions. And I'm going to show you 4 or 5 of them. So first, we start with, this is William James, the father of psychology. He should know what intelligence is, what a mind is. He said, attaining consistent ends by variable means. Attaining consistent ends by changing what you do to get what you want. It's a reference to having a goal. Or you can go to Alan Turing, and he's often credited with saying intelligence is behaving like a person. This leads to the idea of the Turing test. Of course, Turing never used that phrase. And I don't think he ever really proposed this as a definition of intelligence, but it's widely used today that large language models behave like a person, they can talk like a person, so they want to call them intelligent. But I think that's a very limited and unsatisfactory definition because it's behaving like a person. What is it about a person that makes them intelligent? It's not really, it's a sort of a circular definition. So, if I go to the dictionary, it'll just say the ability to acquire and apply knowledge and skills. That's pretty good. I like it. I like particularly its ability. Intelligence is an ability. This is John McCarthy, who's the founding father of AI and defined the term artificial intelligence, or invented the term artificial intelligence. And often in AI, in the field of artificial intelligence, we often say that we don't have a definition. You know intelligence when you see it. And this is unsatisfactory. Often the field sort of accepts that they don't have a definition. I don't accept it. I think it's unsatisfactory. You can have a scientific field, if they know what you're talking about, they'll be able to define the terms. You should be able to define intelligence. And John McCarthy, our founding father, did somewhat late, 1997, offer an excellent definition. This is one of my favorites. The computational part of the ability to achieve goals. Computational part, it's not achieving your goals because we're super strong, because we have really good sensors. It's got to be through computation, and it's an ability to achieve goals. We can drill farther into that, but that is actually, I think, a pretty good definition. I use it every time I get a chance. Although I do have my own definition. My own definition complements that. I think the ability to achieve goals by adapting your behavior, by learning. Okay, so there's some definitions. You can make up your own mind which one you prefer. Your personal sense, this is my personal sense. There should be a science, a new integrated science of mind that applies equally well to people, to animals, and machines. You should talk about minds. What makes a mind? What are its key abilities? What is its essential commonalities become among all minds? And, of course, in the foreseeable future, many minds will be machine minds. So we need a science of them. Doesn't really exist today. You can talk about AI. It's not really a general science of mind that would include people or animals. When you talk about psychology, it does include people and animals, but it doesn't include machines, and it explicitly defines itself as a natural science. And the same has come true of cognitive science. I think the field of reinforcement learning is the beginning of such an integrated science of mind, because reinforcement learning applies both to AI and also applies to psychology and neuroscience and control theory, even economics, I say, for Bob's sake. We'd like to have an integrated science of decision-making over time to achieve goals. Now, I think now we're definitely not doing AI the way I would, what I think is most appropriate. We're in this era of human data where we learn from people. Basically, we try to predict humans' next words, or predict the way a human would label a picture, and then that's fine-tuned by human experts that hover over your large language model and try to make it say the right things and not say the wrong things. This fine-tuning is an endless, unsatisfactory thing because there's always more tuning to do. The world is so big, the possible cases are so many. So, generically, the purpose of today's machine learning is all about transferring knowledge from humans to a static AI that doesn't learn. We don't have learning machines. We're just using machine learning to make machines that no longer learn once they've been created. Large language models never change their ways after they're created. So this approach, we're starting to get to its limits. As in, the internet is used up, and generating genuinely new knowledge is just totally beyond this approach. This approach is about taking what we know and sticking it into the machine. What we want, a true AI, is to be able to generate new ideas and solve problems that we don't know how to solve in the past. Or just learn how to walk on the beach or open a door by fiddling. So I'm thinking that we're entering this era of experience where we have a diagram that's shown here, an agent interacting with this world. It has experiences of red things, the actions, the observations, the reward. Those are the red things. So we need a source of data that grows and improves as the agent becomes stronger. Any static data set like the internet not entirely static, but it's no such data set can be sufficient. It's got to be under control of the agent. And we can get such data from an agent's first-person interaction with the world. I would say this is the way animals learn, including people. This is the way AlphaGo works, this is the way AlphaProof works, the math proving system. And if we look at a child or an infant interacting with this world, it's very clear that the data that it's getting depend on its actions. It will play with one toy for a while, and then it sort of gets bored and moves on to the next toy. It's trying to maximize its learning, perhaps it's trying to maximize its learning over time. And so it's shaping what it sees through its behavior. And that's the kind of thing we need for a proper artificial intelligence. Just show some other examples of ordinary systems behaving, some soccer players behaving, and just think about what's happening, what's going through their minds. They're seeing images, they're moving as fast as they can, everything's changing, and they've got to be sensitive to what's happening, and they also have to achieve their goals. Animals do this. So you see the baseball player swings his bat at a tiny, just a few pixels it sees coming to it extremely fast. The bird is flying through this small opening. The one animal is running away from another. Their experience, think of the data flowing into them and the data flowing out of them, their actions and their observations. It's like a fire hose of data they have to process. Even humans talking to each other are like this. There's enormous signal, interactive signal. What they do depends on what they see, and it's goal directed. Okay, so let me just, this is a concrete example, very simple, of an agent that's moving around in the grid world, trying to go from start to goal where it would be rewarded, and then it learns the path. And there are many parts, key parts to the mind. There's a policy for acting, there's perception, or a process which produces the representation of a state, and value functions, and a dynamic model of the world. Let me just keep going and finish off. This experiential approach to AI is the agent is exchanging signals, sensations, and actions with this world. These are the experience. And they're the focus and foundation of all intelligence. They are the data structure. They are life. Life is data. Bits flowing in and out of your mind and your sense organs and your actuators. And the definition of intelligence is, can I predict and control my data? Can I control the reward that I get in order to make it large? And that defines the goal. So if you didn't have experience, there'd be nothing for intelligence to be about. And there's no way to say that any way behaving is better than any other, because there's no goal. So think of large language models. There's no way for them to tell when they're talking to people if they've talked to people in a good way. There's no way for them to tell if they've done a good job, if they've done better or worse. They are oblivious to the extent whether it's things have gotten better or worse. There's no way of measuring that. The only way they can measure that is if they have during construction and training. Once they're living in the world, they say things and they hope it comes out. We don't hope. We don't have any sense of hope. But we hope. We hope that it will come out well. And we care about what's said. But the machine itself doesn't care. There's no way of saying if things are going better or worse, right or wrong. With experience, they would have a clear goal. The reward, we want to maximize it, clear sense of predictive truth. We predict that something will happen, and we can see over time, we can see it does actually happen. But all those things, all that grounding needs experience. It needs learning from experience. This is, in some sense, I urge you to think of it as a new kind of AI, but it's really an old and super common sense thing. Alan Turing, really the father of computing science, and in 1949, 47, before there even was an AI, he said, what we want is a machine that can learn from experience. He was so right. It's taken the field a long time to realize it. But nothing is more powerful than the idea whose time has come, and maybe the idea of learning from experience has come. Okay, so just to summarize things, AI is turning at last to learning from experience rather than to learning from human input. It's going to be much more powerful because keep learning new things. But despite the hype and fear, current AI is not powerful. I would say it's weak, unreliable. On the other hand, it's useful, and it has ignited a large industry. And it's accessible to everybody through the chats, and this has excited the public. All that's true, and yet it's super clear to me, at least, that we have not reached the main event, which will be the creation of super intelligent AIs, super intelligent augmented humans, and that will bring profound changes. And here in my last slide, is to try to bring it back down to Timor. And Timor is trying to create a digital state, bring in, they might say they're bringing AI into the state. I would say they're bringing computation more thoroughly into the state, and how it works, how it provides services. And this can be a great idea if it's done well, if it's done respectful of the individual. Now, health is hard to do digitally. It's hard to do by computation because it's such an important decision. Our health decisions are so important. We can't learn them by trial and error. They've got to be right the very first time. So this is all problematic. And so I think it's important for it to be done in a decentralized way, so that if we can empower people, the patients, okay, so I did make this the last minute. This is a broken thing, but it can be done by people going onto the internet and learning about the truth, about the symptoms and the diseases, and we can do a lot if we don't make doctors into so remote experts. We take control ourselves. And finally, I think large language models do hold out the promise of a customized, for example, in Turing, interface to all the world's knowledge, for example, the world's health knowledge. Again, we want to do this in a decentralized way. We need open source large language models that can become skilled at Turing, perhaps, or at least Portuguese. And we want to be open to this being done by small businesses that are formed in Timor. So I thank you all for your attention. Try to give you a sense of one way of looking at AI, a way that AI is, I think, is going to be more and more important. The one you're so familiar with today, the large language models, I don't think it's going to be the important way for all time. It could be just a few more years. We should be prepared for the era of experience. Thank you very much.
Thank you very much, Professor Sutton. I'll request you to please come and take a seat in the front row first. But it is certainly revolutionary what you have just said, Professor Sutton. In the era of human data, you still find AI not powerful. I believe everyone here in the audience thinks that AI is very powerful, and we are really challenged by AI in today's context. So, that's what I was referring to, the bitter lesson and the provocative thinking and what you are, in a way, igniting in the minds of the young people. And that's so very relevant when you said to us that the AI has yet to reach the final event. It is still not there. And I think it's a very important lesson for us all. And I think to our young friends, this is kind of an opening up of a further thought process in them and being challenged. Because also remember that he also said in his last line, health is hard. And health has to be done by the people, by the patient, in a manner that it is closest to them. And that is something which is what brings us to the next part of our session, because we are building onto this foundation. And I promise you people that we'll come back and you will all have an opportunity to ask questions to Professor Sutton. But this is where exactly, Professor Sutton, we are looking into what we are trying to do in Timor-Leste. How can we bring AI to the benefit of patient, the people, and how can the ministry be able to take decisions in a much faster way? Every case that is reported or every delayed diagnosis or even an outbreak that was caught early or missed entirely is a data point. And how do we make this feedback loop go faster? How do we catch everything faster? And this is what the whole effort is, that we as technical organization, along with our partner agencies, but importantly to help the people and the government of Timor-Leste. Onto that note, and as I was reflecting that Timor-Leste built a health system which is just slightly more than 2 decades old. And being a young nation, being a young health system, we do look into AI as a very promising option for us to be closing the gaps much faster. And to that extent, what we thought that we would bring to everyone some of the innovations that the Timor-Leste health system is trying. The use of digitalization, in terms of that how can it help the country in decision making, the use of AI in its conquest to defeat some of the diseases, and how they are helping and how they are working, and how the system is kind of getting geared up. So with that background, I would be very pleased and honored to also request Professor Sutton that you're welcome to join us on the panel, please, over here, if you can join. But allow me to also invite Senator Costa. Senator Costa is the National Director of the National Prevention Disease Control in the Ministry of Health, has been until very recently being the focal point for the TB program. I have the pleasure to invite Senator Jose, the Executive Director of our collaborator NGO, NASA Supports Ministry, and he is the one who will be sharing his experiences as well. And I invite my colleague, Dr. Debashish Kundu, who has been a person who has also been engaged and involved in our effort to make the health system, but most importantly from the communicable disease perspective. I would actually, building on to what we just said and what we just heard, let me first throw a question actually, starting with our effort of using AI, Professor Sutton, and some of the young people, those who would not know, but to Senator Jose, because Senator Jose is the one who, with his team, is actually managing the mobile TB van. And the mobile TB van that was introduced by the Ministry of Health with the partnership of WHO is the first one which has an AI-enabled digital X-ray. And you are the one who have the experience firsthand to bring that tool to the people and introduce it over there. So keeping this in mind, can you share with us your experience of how you feel that AI has actually been very helpful to the people and has actually brought what Professor Sutton said, close to people and people-centric approach, using the AI model through the tool that you have introduced in the country. Over to you, Professor.
Okay, thank you, Dr. Harvey. So, our experience using the AI, I think what we learned that AI can be used in a very practical and patient-centered way. From the experience that we have with the TB van allow us to take digital chest X-ray and TB screening closer to the community. And we experienced that the AI software is rapidly analyzes the chest X-ray and helping the screening team move faster and reach further as traditionally done. But we also acknowledge that the AI is not, our AI doesn't replace the health workers. roles, it supports the health workers.
Right.
Do you have a radiologist on board the van?
Yes, we do have radiologists.
So you do not have a fully qualified radiologist, but you have a health worker who is operating onto the machine and onto the X-ray.
Yes, so we were, I think our staff were prepared to train those with very basic capacity to run these machines. So I think we also expect, but I think the most important lesson that we learned is that, as I said, that the AI is not replacing the health workers. And we also learned that the technologies itself is one of the part of the solutions. So the real impact it comes when the team or the system itself recognizes and connected the whole pathway of this cycle of the preventions and treatment of the tuberculosis, where starting from the screening and the diagnosis to the referral and then treatment and the follow-up. So this has remained essential for this work for the health workers. So the experience has been encouraging, I would say, that the AI helping us reach further and screen faster. The real impact, I think, on the public health value comes when you know how the individual being screened can reach or can successfully connect it to the care. This is something that I think we need to bear in mind. So AI is actually helping us reach further and screen faster. An ultimate measure of the success is actually oriented to the patients whether they reach diagnosis and care. I think that's all from.
That's really incredible, but I know that Professor Sutton has a mic in his hand and I would like to hear his reflection. Because what you are saying that AI has helped you to reach patient faster, screen faster, diagnose faster, bring them the treatment and the care, that's what we want. And that's the decision that is AI helping through the van that you are operating. You are reaching out, exactly as Professor Sutton said, decentralized way, go to the people, bring tool to them. And this is exactly what we want to see, that AI is helping when it is brought to the people. So Professor Sutton, just quick reflection on to this, what Senator Jose had just shared with us.
I'm just excited about this application.
If you can take this mic.
I was just excited to hear about this application because of the possibility to really complete the cycle of experience. And you referenced it, that the cycle of the patient comes in, they get a reading, they get, then that leads to perhaps a follow-up, and then a treatment, and then a final outcome. Now, so the AI that I would like to see takes that full cycle into consideration. So for example, the obvious one is the machine says this chest X-ray indicates there's a problem and needs treatment. Okay, and then you actually go to be treated, and you actually have the treatment, and there is an outcome. It would be really nice if we could close that whole loop so that you can evaluate the recommendation of the AI radiologist based upon the actual outcome. And I think today that loop is not. It's like the AI radiologist will look at the chest X-ray and make that assessment, and that will be compared to the human's assessment, which is fine. But you'd also like to be compared to the actual outcome with that patient. Were they actually sick? Did the treatment help? You'd like to have those outcomes come and the teaching information for learning to make better decisions over time. I think that's where we want to go in the era of experience.
Professor Sutton, thank you so much. You are actually giving us so much of guidance with regard to what should be the next steps. Because right now what I am looking at it, that the AI is bringing care closest to the people, as Sana Jose said. He is able to screen, diagnose if there is a TB patient, bring the treatment to that particular patient, or maybe even put the context on preventive therapy. But we have to go still further to look into closing the loop of this whole learning with regard to the overall outcome. And we may actually come back to you, Professor Sutton, to get some advice. And I have one of the best scientists here in the room, Professor Milton, to get some ideas as we go further. How do we plan that part? How do we plan that journey? And how these young people can get those ideas actually? Because that's something which is what I would look to the young people, get excited with the research, AI, in health, and say these are the solutions that Timor-Leste can bring. Professor Sutton, I can just share with you that Timor-Leste was one of the first countries in the Southeast Asia region to have introduced an AI-enabled X-ray for screening, diagnosis, and treatment for ending tuberculosis. And we are very proud. And that brings me to, like our other effort that we are going on and doing with the Ministry of Health, which is actually on the digital tools. Because as Professor Sutton said, that we want to see, or Timor-Leste wants to be going on to the journey of digitalization. And Senator Costa, you have been as a national director now, but earlier as the national program manager for TB, you have been looking into the digitalization yourself and leading this effort. How, you are looking at scaling these approaches of the digitalization, particularly looking into the lessons that we have from, for example, malaria elimination and the effort that you have put into with the integrated case-based surveillance that is already digitalized towards ending TB as well. So how are you looking into it, if you can share quickly your perspective?
Thank you for this opportunity. So Timor-Leste, if you look for the Timor-Leste, we are a new country, just 24 years old. In terms of the utilizing the technology and innovative, Timor-Leste is not behind the other country. Because now we mobilize many technologies for diagnosis and treatment, including the screening of the TB in Timor-Leste. So only TB program does this. So in this opportunity, I would like to share the experience of the TB program plan to explain the scaling up the technology to the close to the patients. So I will explain two things different. First, I would like to explain about the AI system. So AI systems now mobile ban already explained. So I'm who want to mobilize the mobile ban country in Timor-Leste. And all gene experts in the country, I want to mobilize this technology. So currently we have AI system, one in mobile ban and another 10 with the mobile digital portable X-ray. So portable X-ray can be bring closer to the community with the AI. So previously we are relying with the fixed X-ray which installed in hospital or health facilities. So it is difficult for the patient to access to this X-ray. And then now we bring the portable one, it is easy. So only 7.7 easy. So we can bring to the very hard to reach area. So now we use this technology for AI, and it is helping us quick to interpret the results. But it is not replace the skill of the people reading the X-ray, just to identify the abnormality of the lungs, but it is not so that it's diagnosed as TB. So we require the human reading. So like we do so far, we still require the pulmonologist for the reading the X-ray after we show that there is abnormality in the lungs. So meaning that, as Professor said, So AI is not powerful without the human. So human and AI should be together and it will be powerful. So we still require some skill and ability of the person who run this technology. So in terms of the digitalization of the data, previously we are from the long journey TV program, Professor Nelson sitting here. We were together in 1998. We established a TV program in the country. So that time, our journey 24 years relying on the paper-based recording and reporting. And now, recently, we reached to the digitalization of the data, technology. So we already start the digitalization of the data entire the country and all commercial centers in the country, including the private clinics who run the TV program. So this is a big progress in terms of utilization of the technology for digitalization of data. So previously we used the paper-based, we faced the many problems, delay the report and recording is not properly done. But now we utilize the technology. It is real-time data. So once we register the patient, it will automatically comes as per the time you register. However, there is some delay of the registration, even though it is called real-time data, but sometimes the entry to the system delayed 1 week or sometimes 2 weeks. So we cannot reach all the data as per the real time. This is our issue we facing so far.
Thank you, Sir Acosta. I mean, you definitely brought another point. We all wanted or was thinking about AI replacing the human being. But you brought the point again that it is important to have human beings with knowledge of AI to make the maximum benefit out of it. Now, we take that point in addition to the digitalization that you have spoken about, where there are still challenges, but you are maybe closing the loop faster than when it was completely paper-based, as you were referring to Professor Nelson, and then the whole effort that we are making towards digitalization. But that actually brings me a question, because while we are going ahead with digitalization and the AI application, and I will turn to my colleague and the team lead for communicable diseases, and to understand from him is that why did WHO support the conceptualization of the digitalization and the integrated case-based surveillance system, and how it was developed? If you can quickly share with us, because there are still questions that Senator Costa has, and our system should be able to answer those as we go forward. And then we will come back to the audience interaction. Over to you.
Thank you, Dr. Kumar. The integrated case-based surveillance, or the digital surveillance, it was emerged. Yes, thank you. It emerged due to a simple health system challenge. Historically, disease programs collected information separately, mainly aggregated data with manual reporting, and this led to considerable delay in taking timely public health action. The approach overall is fine. I mean, with this approach you get the total cases, but you don't know what is happening to the individual patient. WHO provided key technical assistance to Ministry of Health, to Senior Costa and colleagues, to move from this fragmented reporting to a one integrated case-based digital architecture in DHIS2, which enables tracking of individual patients, turning data into actionable results, and more importantly, for our health workers to reduce their manual reporting, which is creating a huge overload, and we saw that from various joint monitoring missions. TB was a case in point. The revolution started with the TB, and Senior Costa just said that there has been many digital evaluation of TB, and one of them was the demonstration of TB vulnerability assessment, which showed that individual-based information and their geolocation can be easily captured in mobile application in the normal community level setting and also in the household setting, and that information can be passed very quickly to the DHIS2 based dashboard, enabling the program managers to take quick decision. So this actually resulted, and it cumulated to a more integrated and more efficient approach, what is called as a ICPS, or Integrated Case-Based Surveillance, which is part of the overall National Health Information System architecture, which is based on three important principles: integration of diseases, data operability, which means exchange of data from one system to another system, and in this case we're talking about integration, exchange of data from the ICPS case-based surveillance to a umbrella health digital information, which is the National Health Information System, and third is the public health data for public health action. So Timor-Leste actually had shown the way. Data is driving towards better public health action, and this is actually eventually going towards, as Professor Sutton has said, towards experiential learning and towards predictive analytics. So case-based surveillance actually has laid the foundation for this transition to take place in the future, near future. Thank you so much.
Thank you, Dr. Kundu. I appreciate what you have just said, and this is something to challenge all of us, from integration to the data operability, interoperability. But the bottom line to me was what you said is the public health decision making. I think what I hear from three panelists and what we were challenged in between, we have an AI application on the front line. We heard it from Sarah Jose. We have digital tools which are supporting the individual patient care. We heard it from Sana Costa and also Dr. Devashish, that there is an integrated surveillance, and also we are looking into that is bringing us for public health decision making. But actually Professor Sutton's presentation has challenged us a bit more, and we need to hear it from our young minds and our audience, because he has advised that we need a system that actually should learn from the information continuously. Remember the infant video that he showed? It was just not a cute video, it was a very informative video. You have an interaction happening every time, every touch is a data, every touch, and that's what I'm learning in terms of that, the idea of the integrated case-based surveillance or AI on the front line or digitalization is to bring all these data sets to complete the loop and complete the learning. But do we have that machine at the moment that can help us steer the health system in Timor-Leste? On to that note, I would actually like to open it up to the audience. I would really request you to identify yourself, keep your question very concise, and if it is for Professor Sutton, of course you will say it is for him, but if it is for any other panelists, you are welcome to ask questions to them as well. So, audience, I see Professor Nelson hand. Please raise your hand, whomsoever. We have 10 minutes that we could. So, Mia, can you pass the question? Mine to Senator Nelson first. You can switch it on.
You have to borrow yours.
No, that's all right.
Thank you very much. I think I should give my appreciation to Dr. Arvin WHO and His Excellency President and all the Laureate and especially Professor Richard. My name is Nelson Martins. I was a Minister of Health a long time ago, 20 years ago. Involved very early in the construction of our national health system. So I was health coordinator during the resistance movement, and then during the beginning of the continent, Turing and Syria, which also developed TV program. So when we start rebuild the national health system, we don't even have computer. and digital, even no smartphone. And we have to rebuild this health system from the start. No vision yet. But now we are lucky that within the next probably 20 years, new professors are here for this vision. And for us, if we want to be a way to build our health system within the next 20 years, what should the first question, what should we predict or try to envision with AI? And given to this, I think I'm going to be able to slide also about the saying that currently AI is big because only by 2004, AI will be 50% new. So this is very important statement. So it means that AI is continuing advance. And then we mentioned also about a super AI, which is different kind of AI. So my real question is, if by 2040, 50% of AI is only look at intelligence or also they are able to have emotion. And then when we experience intelligence and emotion, AI will become wisdom. And then once when you reach there, I just worry that now, like the professor, when you design the AI, you have emotion, you have a think about human. But one day, if AI replaces you and develop their own AI, so the AI is a superpower, and then the AI is going to design again the new AI. It's not only human relevant. What will happen? So this is my question to the professor. Thank you.
So Professor Sutton, you would like to take that on. Thank you, Professor Nelson, for this very interesting question.
It's an interesting question. It's also a very difficult one. Yes. I think you're looking a little bit farther out to the future. There are several breakthroughs that still need to happen where we can really have powerful AI. What we can do until then, we can just try to apply powerful computation, because we have powerful computation now. We look for patterns in the data. Really good way to understand all this happening right now. It's as if we're becoming really good at pattern recognition. So we can see patterns in the images, and maybe we can see patterns in the longitude data of patients. So maybe we could see coming ordinary increases in disease, like a flu epidemic in our local area. Look for these kind of patterns. It's a hard question. We don't really know what the future will be.
Well, thank you so very much, Professor Sutton, that you still reflect that we should look into still the common data, the simple disease data, and then we can do the prediction, and it is very difficult to really see what the future holds for us. I've been indicated with the limited time, we'll have 3 more questions, so please go ahead. Who is from this side? Identify yourself and tell the panelists with whom you are asking the question.
Good afternoon, Professor Starr and Director Jose, Dr. Costa, Director Bashi. Thanks for the time. First of all, I would like to thank for your sharing your valuable knowledge and wisdom with us today. My name is Solange Ramos, and I'm a medical doctor from Timor-Leste, and I'm currently volunteering with SABE. It's a non-organization governmental that has a vision and missions to ensure the equitable and give fair healthcare system to all the people in population itself. And I am as a young health professional, I'm very interested in how in the potential of the artificial intelligence to improve healthcare in delivery in the developing country like Timor-Leste. My question is, how do we ensure that that technological innovation, how they ensure that technological innovation can ensure that technology innovation can to improve the healthcare rather than bypassing or replacing the health workers. And the second question is, what should we start now to what should we start now to improve our healthcare system and workforce for this AI driving future? Thank you. This is just
Thank you, Dr. Suraj. Very good. Anxiety of everyone that the AI would be replacing the doctors, the coders, the waiters replacing, and also like what should be done by Timor-Leste so that we can optimize. Let me take one more question, and Professor Sutton, we could come back to you. From this side, I see there was a question. Dr. Dominguez, I'll come to you. I see a young hand, young person. You are younger, but let me go to the other one. Please stand up and raise a question.
Okay, thank you for giving me this opportunity. Once again, good afternoon, everyone. So, I think it is very important to consider not only what AI can achieve, but also how we protect patients' safety and privacy. So, my question is on AI governance. What safeguards should Timor-Leste establish before introduce AI into sensitive health data systems? So that is my question. Thank you.
Thank you so very much. Let me have one more. This is related to the governance, and I think it's very important. Sir, thank you so much for asking this question on the AI governance. Dr. Dominguez, I cannot say no to you, so please do a question. I can give you the mic.
My name.
Yeah.
Thank you for Mr. Alvin and good afternoon for Professor Rika. Welcome to Timor-Leste, Director of Dili, National Public School in Malaysia. Speaks for Prof. Wilson and everyone here. Good afternoon. I see that a good season to discuss about the AI right now. We know that AI, personally, I consider that our brother, trained with us this way. But sometimes we're thinking that AI really replace the human is interfacing creativity and thinking, critical thinking. So that this will be give more the pressure and more impactfully to the dance. That's why I have a question to the Prof. Your opinion, your ideas for this point. Because sometimes bring the more time to the people use the AI, and then AI will solve all their problem every day. So will we decrease the thinking, personal thinking, innovation, creativity? What is the Professor's idea? Thank you.
Thank you so very much, Dr. Dominguez. I would request Professor Sutton to respond to three questions. One related to replacement and what needs to be done by Timor-Leste, the challenges with regard to the governance of AI, and also AI as a brother, but if it is going to be providing much faster solution that we will become redundant. So over to you, Professor Sutton.
People definitely have to remain totally in charge. Remember that I think AI is hyped up. It's not as powerful as it's professed to be. And given that it's not that powerful and its reasoning processes are not that effective, it should not have the final word. It has to be watched over. And so we have to, one reason we have to fight the hype is that the hype would suggest that we can give control to the AI, and that would be a terrible mistake at this point. So we cannot believe that. We cannot allow that to be imposed. The AI should help the healthcare worker be more powerful and more effective, not weaken them and not replace them. It should make them stronger and better. And it should always be done as an assist. If someone comes in and tries to say, "Oh, we can replace you," that is wrong. No, it has to. I mean, we are nowhere near that. We should be enhancing and making our healthcare workers more powerful through AI rather than replacing them.
Professor, any reflection on the issue of governance? That what should Timor-Leste government policies be with regard to controlling or governing the overall AI initiatives or AI and digitalization together?
Well, it's the same answer. We should not imagine that they are so powerful and capable. Even the idea of putting on guardrails is assuming, oh, most things they'll do, and they will just prevent a couple of things. No, every time we have to reassess, and we just shouldn't give that much power to the weak machines we have today.
Thank you so very much, Professor. And I know that we have a lot more questions in the audience, and I would say that maybe over coffee we could interact with Professor Sutton still. I know our next session that is going to be happening, I see our colleagues standing over there, and I would hate to not, let them take the podium very soon. But on to that very note, Senator Costa, just 30 seconds if there is anything you want to say. Quickly.
So, regarding the patient safety and privacy, so once you utilize the AI system, like X-ray, the role is should be only annually for one patient. And also, we have the biomedical engineer. They will make sure that all the distance of the person to access during the X-ray is operated. And then the radiation in the small X-ray is not like the big X-ray one. So it is not big impact to the radiation. And the privacy, like data system, digitalization of data, we use the password and also use the username. Only this person can access to the data. The other one not allowed to access the data. This is privacy and also safety, patient safety.
Thank you so much, Senator Costa. So there is, of course, importance of some safeguards and guardrails, and to make sure that we do have confidentiality and privacy. Artificial still is artificial, and what has been told by Professor Sutton, that actually AI must augment human capability. So you and I as medical doctors should get augmented with AI rather than being fearful of AI, and it should not be replacing the human responsibility. So we still remain very relevant to provide patient care, both as doctors, nurses, midwife, technicians, anywhere and everywhere. I think AI is there to augment our capability, and let's resolve that we would work in Timor-Leste to utilize AI to make it happen, that it will augment our capability for the benefit of the people of Timor-Leste. On that very note, let me profoundly thank Professor Sutton for your wise words, wisdom, and a big round of applause for Professor Sutton. In a very simple way, he could explain everything. And a bigger round of applause as well for Senator Costa and Senator Jose for really making sure why we are doing AI and digitalization. And thank you, Dr. Kundu, for him from the WHO side to provide that relevant technical assistance to the government and people of the world.